This course covers the current state of healthcare, the impact of the Affordable Care Act, the challenges facing the industry, and how value-based healthcare can address those challenges. So, what is value-based healthcare, and what do we mean when we say value? Value is defined as the quality of the patient outcome relative to the cost of reaching those outcomes. The ultimate goal is to maximize value by attaining the highest quality of patient care at the lowest possible cost. It is essential to transition care delivery away from the volume of services performed on the patient to services that provide distinct value for the patient. Presently, a large portion of our healthcare system relies on a fee-for-service model, which maximizes the cost and volume of services performed on the patient. The fee-for-service model has a fragmented structure that fails to reward superior quality of care, outcomes, efficiency, or care coordination. Physicians drive up costs by defensively prescribing duplicative services to prevent lawsuits for negligence. The lack of cost transparency causes confusion and insulates patients from understanding the true cost of care. Given the evident downsides of the current fee-for-service model, it is logical that industry forces are exploring new models capable of more coordinated, patient-centered care. The Affordable Care Act has put pressure on payers to reduce costs and move toward performance-based reimbursement. Healthcare spending is growing at an unsustainable rate. U.S. healthcare costs are projected to reach 20% of GDP by 2021. The U.S. drastically outspends its peer-developed nations, and that spending has not translated to superior quality of care or population health. Aging population and above-inflation cost growth continues to exacerbate this problem. To improve the quality of care and drive cost savings, the value-based healthcare model seeks to enhance care coordination, incentivize providers to pursue value over volume, standardize quality metrics, and increase cost transparency. Many key opinion leaders have accepted and endorsed the move towards value-based care. No longer will healthcare be about how many patients you can see, how many tests and procedures you can order, or how much you can charge for these things. Instead, it will be about costs and patient outcomes, quicker recoveries, fewer readmissions, lower infection rates, and fewer medical errors, to name a few. In other words, it will be about value, and that is good.